vanhu vahapo vete kucha ngengo kwafakwa ta konkisi afake na shilongo mala ndwete kucha mungala mwenyo yayo kuno shilongo ikeshashi ngengo kwelu fake mango totalombweba kuna petro milongo mbali nasha na tango komesho shonjue.
My advice to those who are living with HIV and AIDS is not to spread it. Take care of your partners.
They must be strong. They shouldn't listen to what people are saying, negative things.
They should always know that whenever they sleep with another partner, they should always use a condom.
Take their medication, eat healthy food, veggies and fruits, and take care of their body, exercise a lot,
and don't always think negative, think positive, girls and boys, and don't do what your friends do. You always, you should know this: bad friends, bad influence. Listen to your advice of your parents.
Which you are HIV positive. So let them know. No kujapo taveku taking care aveku kwa fere kesha pata vaduru.
They should know that the disease it's a normal thing, it's a normal disease, so they shouldn't freak out.
When you have HIV, you will be able to live. If you have AIDS, you will just die. So you should be careful, abstain from sex.
To the people that don't believe in condoms, it's really otherwise. It's weird, I might say, that because condoms is there for protection, for us not to be having sexual transmitted diseases, So they must really, it's a must that they should really use condoms.
Don't infect someone, you must tell him straight.
Situated in the heart of southern Africa, Namibia is home to some of the world's most unique fauna and flora. Bordered by Angola to the north, Zambia and Zimbabwe to the northeast, and Botswana to the east, this country is home to a population of 2.14 million inhabitants. Besides being one of the youngest African countries to have gained independence, Namibia is also seen as one of the most economically and politically stable countries. However, not all is well that ends well, with a prevalence rate of 18.2% amongst pregnant women. Namibia has made remarkable strides in the fight against the scourge of HIV and AIDS over the last 2 decades. HIV/AIDS is a serious issue in Namibia, and young people need to be aware of the reality and risks associated with the epidemic. Still being ranked amongst the top 5 countries with the highest prevalence rate in Southern Africa, it has become so easy to do a comparison with the US, having 1.3 million people living with the virus, with a fifth unaware of their statuses. Since the discovery of HIV back in 1981 in the US by Dr. Robert Gallo, an estimated 1.15 million people in the US have been diagnosed with HIV. According to UNAIDS statistics of 2013, 250,000 people are in fact living with HIV in Namibia. A grave and black story should speak of a promising present and future. This is indeed the Namibian and American story. Despite the stigma, discrimination and poverty attached to HIV and AIDS, we met up with individuals from America and Namibia who continue to persevere and address the challenges to overcome this hurdle.
I was diagnosed in 2010, late 2010, with HIV.
While waiting for my friend to see the doctor, then I decided to kill time by joining the testing center.
In my house, we didn't talk about HIV and AIDS either. I think the only thing in my household that we've really discussed was don't bring home any babies.
My childhood ended, very short when I got pregnant at the age of 17, things changed. I couldn't be a child anymore.
My name is Nick DeLuca, and I'm the Chief of the Prevention Communication Branch here in the Division of HIV/AIDS Prevention at the Centers for Disease Control and Prevention in the United States of America. CDC is the lead federal agency for HIV prevention activities. So we have a whole host of activities that happen through our headquarters here in Atlanta, Georgia. We work very closely with our state and local jurisdictions. In fact, the majority of our funding goes out to those state and local areas for them to fund local health department initiatives and activities. We provide guidelines and recommendations and direction on how we think those funds should be used, and then people then in those states and local areas also look at what their individual epidemic is and then target the funding to best reach those individual areas. So the epidemic, say in New York, might look different than, say, the epidemic in Georgia or California or another state. So there's a lot of room at the local level to be able to guide those prevention efforts to make sure that you're addressing everything that happens at that local level and have the highest impact. So young people in the United States are particularly at risk for HIV. About 1 in 4 new infections take place among individuals ages 18 to 24 years old. That's about 12,000 new infections a year. Our data shows us, too, that among those young people, many of them are gay, bisexual, or men who have sex with men. So we need to make sure that we target our prevention activities to these groups. Reaching out to gay and bisexual individuals is a very important strategy for our overall HIV prevention efforts here in the United States. We engage these groups of individuals in our background research in the development of our interventions, in the development of our campaigns, and we make a particular effort to partner with many of the local gay, lesbian, and transgender groups in the United States to make sure that we're have a way to bring up HIV and AIDS and to also make sure that they have resources to be able to address this epidemic in that population.
And that was the time when everything basically started in my life. Being pregnant at such a tender age, you know, not knowing what it really means to become a mother, and all the responsibilities that has to come with being a mother. Nobody ever explained to me, you know, just the fact being a mother already was challenging to me. And then here comes, you know, you're infected with HIV. So it was like a whole blow, like, you know, 2 hits, you know, at the same time. And it was very confusing. At that time, I could not really make out, you know, where life is really heading to. You know, am I going to die? Am I going to give birth? How? And I had so many questions and was so confused at that time. And I also didn't understand what it means or what it meant to be HIV positive at that time. I was still schooling, still, you know, a student, and, you know, I got pregnant. I had a promiscuous teenage life. I was engaged, in a relationship, and I got pregnant. I knew I was pregnant, and I couldn't open up with my mother. And eventually she picked up, you know, during 5 months that, you know, you're gaining weight and all that. And we ended up at the clinic, and it was a private consultant. I think back then it was routine, you know, for women by that time to be tested for HIV as well. So they tested me for HIV, and the same day I got the results of pregnancy confirming that I'm pregnant. So that was a blow to my mother as well. I couldn't look at her. And at least we went on, and I thought, okay, you know, like you would always think, okay, I've messed up, but, you know, life goes on. She would forgive me, it's there, and we need to move on. And a week passed, and I was called. I'm the one who answered the phone, and the nurse informed me that, you know, you need to come to the clinic, make sure that you bring both your parents. So by that time, I had my stepfather, who was also there. But I didn't have any idea that, you know, it could be something serious, or, you know, I was just like maybe something else. And we ended up at the clinic, and there we were informed that you're having HIV. And again, I didn't understand what it means. Nobody explained. The doctor was there, but they never really explained. It was very short, and I was just told that, you need to change your life, you need to turn your life to God. Sort of like an impression that, you're going to die soon, so it's rather good you die in the hands of God now. I think that's where the challenges of stigma and discrimination started, and it only not starts with the people outside, like your families. It starts within you, or it starts from you, because you don't understand, you don't know where you belong, you don't know what you need to do. All you know is that, or that you knew back then, is that if you're HIV positive, you're not human anymore. So you can imagine.
What happened is during the 8 days before I disclosed to anybody else, I was going through some depression. I was drinking a lot while trying to figure out what to do next. And I had a few plans with me. The first plan was to commit suicide. Then I said, no, I was scared to die. Then I decided to maybe just keep on drinking and keep it to myself. Then still it was killing me inside. And then I decided to spread the virus. Then I also came to cancel it. And then I finally just say, let me open up and then become an activist. Well, I started with the journey from Ongwediva on Sunday. The first person I told was my mother, then my father, then my aunties, my closest family. And then later I put it on Facebook for all my friends.
My name is Sandy Sharonda. I am the Executive Director of NASO. NASO stands for Namibia Network of AIDS Service Organization. Namibia has done tremendously well in various areas. We have moved from a time of panic, as I said, to a time now that where we can say we are managing the epidemic well. We have moved from a time of high stigma to an era where now we are able to integrate amongst us, and we accommodate each other, and we now understand that somebody who is HIV is not completely sentenced to death. They now have a chance to continue to live a normal life. We have, within the sphere of HIV management, we have brought in antiretroviral treatment, and that is helping to prolong the lives of people. We have brought in programs such as PMTCC, prevention of mother-to-child transmission. That means the babies that we are now, mothers are giving, are clean of HIV.
Go! Support your teammates! Go Veta! Go Veta! Go Veta! Go Veta!
The Frank Felix Foundation, in the fight for HIV and AIDS. The program started 3 years back, where we just saw the need in this community. We just wanted to change mindsets, and just be the difference in the community, especially Babylon and Havana and Hakana. We just really wanted to reach out to the young people in this community and just bring awareness on HIV and AIDS. It started very small, but now looking back, it's amazing. It's amazing the impact it's got on the community, the eagerness, even if it's only a few people, but you can see the passion and you can see the eagerness they have for this kind of thing, and it's like they are hungry for this. So you have to abstain you have to avoid touching these cones. So we will have a consequence. So you don't want to go through unwanted pregnancies and HIV and all those things. So the risk is here. The risk is having unprotected sex, something that puts you in danger, right? Alcohol abuse, that's a risk. Sugar mummies and sugar daddies, that's a risk. We've realized that when you come to young people, they get bored very easily. So we decided, why can't we use sport? Why can't we choose a certain sport? And we chose soccer, because a lot of young people like soccer, they love soccer. So we decided, let's use soccer as a tool to bring HIV awareness. They just don't want to sit there, They want to make it practical, to make it interactive, so they can also have fun and
And it was also a thing of, we want them to come back.
Come on, guys, I can't hear you. Go funky, go funky, go funky.
More education background about HIV and AIDS and the effects of HIV and AIDS. So I was like the one who was helping the others, like telling them, correcting them, taking a step with them. So it was sort of a good experience for me.
The epidemic, it keeps changing faces. I must say that you might think that you are dealing with this case now, while you realize that there's something else that is emerging. There are so many areas that we still have to deal with. We are not saying it's over. We have the youth that is still infected. There are a couple of statistics around young people still getting infected. There are issues of dealing with the issues of where we are coming from. Adolescent issues, where you still have issues of young people that come from the 90s that were infected during the time that that we didn't have ARV in the equation, that are currently now adults or adolescent. That means they are 20, 23, 24. They are dealing with issues of making decisions. What is it that they need to do? And sometimes they don't have guidance because some of their parents are not there, because some are orphans, but some are in very high school levels, and they're making decisions of whether to marry, whether to disclose their status to their friend, and these are very critical decisions that they're making.
I found out at a testing fair at the Howard University. They had a health fair, and 3 people walked up to me and asked me, did I want to get an HIV test? And I was like, I don't look like the people who are HIV positive, because, you know, the image of HIV at that time was Tom Hanks in Philadelphia to me. That was the vision of what HIV looked like. A white gay man, and so I figured, I'm not white. Well, I was gay. I am gay, but I wasn't white, so I figured I didn't fit that particular demographic. But the 3 people asked me to get tested, and so I did. And 20 minutes later, it came up positive. Was I scared? Not really. Was I shocked? Very much so, because I thought I did everything in my power to protect myself, although I was sexually active. But the news that followed afterwards was that I had HIV since I was born, and that's when the conversation that's where everything started from that moment. After I received my diagnosis, of course, there's a confirmatory part where you have to wait 2 weeks, and so those 2 weeks, I just kind of, you know, was just waiting for that confirmation. I did notify my sexual partner because I felt that was the right thing to do. And as I think about it, probably the scariest thing to do, because it could have put myself in a more dangerous position, sharing it. I mean, it wasn't like I was having like a million sexual partners. I'm trying to make it seem, but I felt like it was the right thing to do to tell my sexual partners at that time, at 16. But when my confirmation test came out, I did inform my guardian of my HIV diagnosis, and she informed me that my birth mother died of AIDS. And I did not know that my birth mother died of AIDS, AIDS complications. What I was told was that, you know, she was sick. So I didn't really question much about my mother's as far as how she died. And I think the moment that I discovered my HIV diagnosis is the moment that everything started to make sense. That when I got that information, I asked my guardian, "Can I have a drink?" Probably not the right thing to do to ask your guardian. She didn't give me one, of course, but it was like a lot going on because you know, at 16, I'm thinking about prom, I'm thinking about college, I'm thinking about the next phase of my life because I was approaching 17, so I was almost at the senior year of high school. So then you have to add also, what does it mean to be a 16-year-old person who's HIV positive? I didn't understand all that what I was, you know, had to face, and so it was a very confusing time. It was a very difficult time. at that age, but it also provided me with a lot of resiliency, how to navigate systems, how to properly take care of myself. Still learning that, you know, as I age. But it was a defining moment in I would say my short life right now. You know, it was definitely a moment of where it gave me a lot of clarity, gave me a lot of perspective, and it also taught me how to do what I do now, how to advocate for those who may not have had the luxury or resources to be able to have health care and have people behind you and beside you. And so it birthed my purpose and passion for HIV care and advocacy.
When I found out that I was HIV positive, the pregnancy was not planned, and I took it, I was kind of numb in the beginning. It didn't mean anything because that was too much to kind of understand and take in at the same time. Okay, so I was kind of nonchalant about it. I kind of just didn't care. Well, when I started taking the medicine, because I found out early, as opposed to waiting a long time to get tested and to get treated, I found out one day, 2 days later, I made sure that I went to find out what can I do next to take care of my health. And initially they said I wasn't going to have to take medicine, but once I found out that I was pregnant, they said that we need for you to start taking the antiretroviral medications to protect the baby from getting the virus. I didn't understand what that meant at first. I just understood that it was just medicine. And I learned that it was basically suppressing the virus so that the rate of transmission could be less than 3% of my child being born with it. So what moved me from not caring to caring is understanding that I have an opportunity to protect the next generation. Taking accountability to be accountable for not putting this child at risk.
When we look at some of the successes that we've had with HIV prevention in the United States, our data shows us that since the beginning of the epidemic, we've been able to prevent approximately 350,000 new infections overall. I think we've had great success in getting close to eliminating transmission of HIV among pregnant women to their children. There are still a handful of cases that take place each year in the United States, but we have very extensive programming in place to make sure that those numbers are close to zero. And so we're really excited about our progress in that area. And we have some campaigns.
If I could say something to people who don't know anything about HIV, and especially people our age, in our 20s and 30s, like it's really about time to really do our research, because if I didn't know Kelly, I would still be ignorant to HIV. She was just like an average person, and I guess I just had stereotyped the idea of people who have HIV. And